Hello, folks. You're very welcome to our March Fields of Knowledge session. We again have a very interesting panel today for our discussion, following on from last month's discussion, which looked at relationships and community building across rural America. Today, we're going to advance that on to a more clinical and health focused and also like program delivery focus that looks at the topic of cardiovascular health among the farming community. So we know that farmers face particular challenges in relation to their health. And in the context of today's conversation, we know that they have an increased risk of cardiovascular disease compared to their non-farming peers. So before we get into the nuts and bolts of today's session, just some context in relation to fields of knowledge for those of you who might be joining us for the first time. So the essence of fields of knowledge is that we bring together researchers, practitioners, and community members and leaders to tackle some of the most pressing challenges that rural America faces today, particularly in relation to health and particularly in relation to the farming community, which we serve through the Northeast Centre for Occupational Health and Safety. So for context, my name is Conor Hammersley. I'm one of the researchers here. I predominantly focus on the area of farmer mental health. And as part of our outreach efforts, I moderate these fields of knowledge sessions. So, and just before I get into introducing our panelists for today's session, just some housekeeping rules for everyone. So we really encourage attendees to engage in the topic today and the discussion. The chat function is open. If you have any questions or even comments or queries, or you can add the discussion in any way, please just drop your messages into the chat. I'll be keeping track of the chat, and my colleague Destiny Tremblay, who's in the background, she'll be keeping track of the chat also. And I'm also just conscious of the fact that this is a live session, and it could even be quite an emotive topic for certain people. So just be mindful of each other as we navigate the conversation and when we are using the chat function. So without further ado, I'm going to start by introducing our panelists today. So first up is an old friend and former colleague of mine from all the way from Ireland, Dr. Diana Van Doorn, who's a research officer at Teagasc. Her work focuses on the intersection of social, occupational, cultural, economic, and systemic factors that shape farmer health and safety. She works directly with farmers in rural communities, using engaged research approaches to understand their experiences and co-design evidence-based initiatives that put farmers at the center of social sustainability. Diana's PhD in particular looked at the cardiovascular health of farmers in Ireland. Next up, we have Dr. Brian Quinn, who is the medical director at the New York Center for Agricultural Medicine and Health and is an occupational medicine physician who trained and studied at both Harvard and Columbia University. And finally, we have Vickie Gwozdz, who is the Community Heart Program Coordinator with HealthWorks here at NYCAMH, working closely with community-based cardiovascular screening and health initiatives. So you're all very welcome.
Thank you.
Thank you.
I'm glad, Diana, we got you at a good time. For context, Diana, everybody is Dutch via Ireland at the moment, and today joining us for today's discussion. Brian, I might come to you first. I think if we could maybe ground the discussion, in a working definition of cardiovascular health. I feel like these topics, like a lot of the health and well-being topics, or terms are often used quite loosely and without much, ground. You hear like emotional health and well-being, all these kind of things, and they very rarely have much grounding. And I wonder if you could kind of position us for what we mean by cardiovascular health.
Yeah, sure. So I'm a physician, and so as a physician, we kind of look at health as sometimes from the opposite point of view, from lack of health. And so cardiovascular health would really be absence of cardiovascular disease. So we have to understand a little bit what we mean when we talk about cardiovascular disease, I think. And it really comes in four manifestations: cardiac or coronary disease, heart attacks, um, cerebrovascular disease or strokes and TIAs and that sort of thing,
Hmm.
peripheral vascular disease, which is same kind of process in the blood vessels of the legs and arms, and then aortic disease. These are all sort of the same process, and that underlying
Right.
process is what's called atherosclerosis, this layering of fatty material on the inside of the arteries. Um, so when we think about cardiovascular health, we're all born with presumably, unless there's some sort of congenital issue, in good cardiovascular health.
Right.
And as we age, things happen, and it actually happens at an early age. From even in the teens and 20s, people start to develop this atherosclerosis, early signs of it. Um, and there are things that we can do to limit that process and sort of kind of maintain that health that we were sort of brought into the world with.
Hmm.
And the factors that we can do something about include blood pressure, lipids, the cholesterol level, uh, glucose intolerance, diabetes, whether or not you smoke cigarettes. These are the main modifiable risk factors. There's other things that are more minor, and then there's some things that you can't do anything about, such as whatever your genetic material is. You
Right.
really can't do anything about that. Um, but this applies, of course, to everybody. I'm not talking about any one group with this. This is just humans in general. Um, the American Heart Association talks about something they call life's essential eight, and I think this is something that would lead to, I think, optimal cardiovascular health. What they feel.
Hmm.
Uh, One is not smoking. Two is being physically active. Three is maintaining a normal blood pressure. Four, normal blood glucose. Normal blood cholesterol. Normal weight.
Right.
Eating a healthy diet, and having healthy sleep patterns. This is what American Heart Association recommends for trying to maintain what we're after in terms of cardiovascular
Right.
health.
Right. That's really interesting. I think, as you said, that there's some like genetic factors that are predisposed to certain individuals that can complicate cardiovascular health. But from what you're saying there is there's a hell of a lot of lifestyle factors that are associated with it. And I suppose, and that brings us on to our focus for today, looking at the farming community. And I'm wondering, Diana, because I know you did your PhD in this. I know that your work is much more broader now at the moment, looking at like the wider holistic and structural health of the farming community. But could you just give us some context around farmer health and cardiovascular health and what that looks like and what are some of the challenges farmers face in relation to their lifestyle that by extension leads to cardiovascular disease?
Yes, well, my research found that farmers are a high risk for cardiovascular disease. This was in Irish context. Um, the rationale for that was a study which was done on mortality, and up until that was in 2013 published, and until then there was a lot of research from especially Scandinavia that farmers actually were healthier compared to the national average. And then in
Right.
Ireland they found that farmers had higher mortality rates, 7 times higher mortality rate from cardiovascular disease compared
Mhm.
to salary jobs. These were premature mortality. These were farmers between 15 and 64. So then we developed an Farmers Have Hearts program, which was a health check program for farmers. And I evaluated that then as the pilot started. And we found that 74% of farmers had 4 or more risk factors for heart disease. And there's research that showed that if you have those 4 or more risk factors for heart disease, you threefold the risk for an acute cardiac event. That led then to my PhD, which then looked at a lifestyle program, a support program, because like Dr. Brian just explained, and the World Health Organization estimates that 80% of heart disease can be prevented by lifestyle changes. And for farmers, we see there is not a particular jumping out results. Everybody has their own cardiovascular profile in my research. What was shown is that obesity, overweight and obesity was a huge risk factors for farmers in both my studies, the one in 2013 and the one with the lifestyle program. And then we saw a lot of clustering. Stress was an issue as well. And for farmers, this is an issue because clustering of risk factors for heart disease can also lead to safety issues. So farmers with high cholesterol, high blood pressure, and overweight have a 5-time higher risk for an injury, an accident in farming. So there's a huge consequences of the risk factors for heart disease. I also looked in my study between 2 subpopulations of farmers. We looked at dairy farmers and cattle farmers. In Ireland, they are different based on their socio-demographic backgrounds. So beef farmers tend to be older. They tend to have lower education. So the broader impacts and the broader determinants of health impact cardiovascular health as well, as shown in my study.
I have so many questions. I might just follow up with one other point about that, and I think just for everybody watching in on that. So, like traditionally, farming would have been looked at like as a physically active occupation. So sometimes, like just like descriptively, it's just hard to make those two up. Now, that's not controlling for diet or stress or anything like that. But you would think that farmers are physically active. Maybe that's not the case anymore because of the onset of machinery and that. So that's my first question or point if you want to develop on. And then the next one was, how does the link between poor health and increased risk on the farm? How does like obesity and increased risk? What is the link between those two?
Yeah, they are very good questions. Indeed, farming tends to be perceived as an highly physical, active occupation. There are studies out there which shown that farmers underestimate their levels of physical activity due to machinery. There's also contradicting studies who say that farmers really have more physical, occupational physical activity. That's a difference as well between leisurely physical activity because, and Dr. Brian, please come in if I say something wrong here, but it is important that you have moderate exercise, that your heartbeat goes up. So it depends on the type of physical activity as well. In my study, I have to say I had 900 farmers in my study, so it was a large study. Especially the beef farmers, they had higher levels of physical activity compared to the dairy farmers, yet their health profile was worse. Their cardiovascular health profile was worse. So there is something which need to be further researched as in how the mechanism works, or maybe that risk factors are not all equal, that is a thing. And your second question was again, the relationship between risk factors and cardiovascular risk factors and safety. And I think, again, this is studies I have read, risk factors for heart disease can make you out of breath, can impact your reaction speed, and they are all important for farming, to safe farming. And also age is an issue, or is a criterion, a factor for higher risk factors for cardiovascular disease. And farming in Ireland, you see that the majority of especially fatalities is among older farmers.
Really interesting. Thanks for that, Diana. Vickie, I might come to you next. And in relation to more like proactive screening, and if you tell us a small bit maybe about the community heart program that I know we were chatting earlier, and you were saying it was through the cardiology department at Basseter, you work closely with them. Could you just give us a sense of what that looks like, and its role in kind of increasing awareness and increasing opportunities for farmers to get screened?
Right, so we go out to any kind of health fairs that we can or get invited to, and whether it's farming community or just community in general, and we'll do like a risk assessment for them. We'll take their glucose and their cholesterol, and it's a little machine that we use, and we kind of go over their numbers and let them know what their risk assessment factors are. And we kind of guide them on how to eat healthier or exercise more, or what they can do to better get themselves back on track with their numbers. A lot of farmers, in our areas don't always have access to go to the doctor, or they don't go to the doctor for health insurance reasons or whatever. So it's kind of nice to be out in the community and to have this for them.
It was really great. Yeah, I know. Yeah. And in terms of, like you were saying to me earlier that, you might be at a farm show or that, and this is similar to Diana, the work around farmers of hearts and stuff like that. And, and if it's put in an environment that farmers are at, they tend to be more interested and proactive, and they're coming to you looking to get their blood pressure
They are.
checked. Yeah.
They
I don't
are.
know. There's some really good lessons, I think, in that,
And some farmers are very proactive on their own health, and some are not. They're like, oh, we never go to the doctor. We come here and we find you every year because we want to have this done, and because we don't see a regular doctor. And then on the other hand, we have some farmers that come to us who just want to know their numbers. So the next time they go see their doctor, they can say, oh, I had this done, it was, just a screening, and this is what they told me, and I had my blood pressure done while I was there. So
great. Yeah, really interesting. Brian, I might come back to you. I just building on the work of what Diana spoke about there, what Vickie spoke about. I suppose the objective is that it gets to a point that it doesn't reach you, or it doesn't come into the opposite, or people don't reach, get to a place where, they're, as Diana mentioned earlier, in an acute cardiac space. Just how important is that? Those outreach efforts to get to more hard to reach population groups, be that in rural areas or be that in, in farming communities too as well, who's their hours of work are often at odds with healthcare hours. They mightn't have staff too as well to work in the farm while they're going. There's a lot of kind of complicated factors around, going to seek support, I suppose.
Yeah, I had, for many years, I worked in emergency medicine, and I would see some farmers even here when I trained at Bassett many, many years ago. And I was struck early on how, these people didn't want to come to the hospital under any circumstances. And they were sort of against their will. They were there because they had some sort of horrible problem that needed to be dealt with.
Right.
And then they didn't want to come back to get it checked or anything. So this is the mentality, because it's part of their life, I think, is their work. They don't want to take the time to, for something like, especially something like preventive care, which is, I think, a hard thing to get people to make any sacrifice for. So, I don't really know what the what the numbers are as far as how effective these programs have been locally, but my sense is that they've been very very well appreciated by the farmers, and we do other groups also. And I think that it's very well appreciated by them, and I can only imagine that it's helping. Because sometimes, as Vickie pointed out, this might be the only time that these these people will get a medical evaluation that whole year. And if we're telling them, hey, look, your blood pressure is really high, and it's very important that you get this, dealt with, that that works, I think. But they
Yeah,
need that. They need that. That initial, connection.
right.
Mhm.
Totally, totally. And I think that as Vicky was saying, there are some people that no matter how close you get to, they're going to be maybe resistant to engagement in it anyway. But there are significant structural, occupational, and cultural barriers that the farming community face. And Dana, I know you've dealt in a lot of these kind of things. And one of the things that's really interesting in the United States here in comparison to Ireland or in Europe is the issue of insurance here. You know what I mean? Like farmers
Yeah.
literally, it's kind of like leave well enough alone, or I just I won't open Pandora's box by going for a checkup because God, they'll want to see me again. I'll have to put out more money. They might want to do some
Yeah.
operation. God only knows what
Yeah.
they'll say. You hear farmers saying these things. I'm wondering, like, what is your sense of that in Ireland around the systemic or structural barriers around around help seeking and being proactive about their health?
Yes, well, I recognize completely what Brian said there. The same is in Ireland, as in, like, they're hesitant to go to the doctor. In my research, 74% did say that they went to their GP in the year beforehand, but then they didn't go. It was in a reaction, as in, like what you described, they couldn't wait. It was an injury or it was a cold that didn't go away. It wasn't because they wanted to prevent something. I think it is also complicated because a lot of risk factors you don't feel high cholesterol, high blood pressure until it's very high, and then you're very late as well. I do see that in Ireland we have the same, like it is hard to get into healthcare, maybe not public healthcare because of waiting times. But farmers do have, it was around 50-50 who did have health insurance in my study. We do see that there's masculinity norms, as in, with health help seeking. So, as in, I can't be seen, so I'm strong, so I tended to not go. But meeting them at the livestock marts, meeting them at the dairy co-ops, that really, really helps to break the ice in meeting them. We evaluated the program, so we saw a year, and I offered a lifestyle support by health coaching and or health promotion text messages, and then farmers came back after a year, and we saw that the farmers then, with the lifestyle changes, had improved their cardiovascular risk profile. So these programs definitely, make farmers aware or help them. And I don't know, Vickie, if you have the numbers, but 4% of the farmers in my study went to have a stent or surgery. So that was really life-saving intervention, and they didn't come
Really
back for the
well.
repeat health check because they were then in the medical
System,
care
right.
and system. And we see as well that what is a problem in Ireland is, once you're in the public system, you're in the system. There's long waiting lists. So
So,
the accessibility of care is not always there.
Right. I think I
And
remember
another
seeing.
thing is what farmers, and this is also in Ireland's research, and we did an actually a survey last year, and that came out again, is that farmers do not feel understood by traditional healthcare, you know, or the times don't suit them, or they feel they are getting advice which is not relevant to them, or which they can't fit into their lifestyle.
Right.
So this is a systemic issue where the way healthcare is maybe offered, you know, could be maybe more farmer centered. And this is not only or rural centered. This goes obviously for more occupation groups who have problems, you know, going between 9 and 5 to the doctor, because that's the
Right.
time the doctor works.
Mhm.
So true.
And Vicky, you might want to come in here on this, but did I pick that up right, Diana, that you said that 4% of your sample
Yeah.
referred to a medical emergency from the screening
Yeah.
for
So
acute
they were,
care? Yeah.
yeah, they were identified with risk factors and sent to, there was, the nurse gave a number, you know, an
Yeah.
urgency to, and all farmers get an letter for their GP, and they were sent to, with urgency to their GP, and had then, as a result, stents placed or surgery. Yeah. So life-saving surgery. Yeah.
I don't
I
have
think.
any numbers like that, but I just wanted to ask you, Diana, do you find that if the farmers married, that their wives are more proactive than the farmers? Like the wives are more apt to be like, oh, you need to see the doctor, or yeah, we're gonna do this today since they're here to do this.
Yes, but we this was also, we had a gendered lens on my study, so it was from Ireland has a men's health policy. So we really also tried to work around the wife as well, and to place the responsibility at the, you know, on the
them.
male farmer, and try to get them take responsibility for their health, rather than that, you know, that is placed on the spouse, who has a lot of other responsibilities as well.
Right.
And I noticed that we had really strong engagement strategies based on best practice and working with masculinities. And the farmers in my study were really interested in, you know, their diet and cooking and changing things. And we got feedback as in, oh, I now do the groceries as well, and I bring packed lunches. So that there was a huge change going on. But definitely also sometimes the wife takes, you know, answers the phone, and then I would ask, like, can I ask a few questions? And she would say, oh, I can answer them for you.
Yeah.
You know? And you were like, yeah, I know, but I rather speak to your husband here. Yeah.
That's so funny. I like, because it's like, and it's an interesting point, because like, who's not guilty at some part of their life and they have not been proactive about their health, not going for a checkup or putting it off. Like, we all get caught up in life, and life takes over, and you forget about that until, you know, something happens, you know, with it. And I think in relation to the farming community, and it's often said, I'm kind of playing devil's advocate with this, with it, in terms of like health services are not adequate for the farming community. But, and Brian, maybe, I don't know if you want to come in here. Do you think, like, is that a fair critique of health services, that it's not that they're not, you know, the opening times and all that are not relevant to the farming community? Like, is it feasible? Like, that they're just one occupational group. Like, is health service, are they supposed to accommodate for every occupational group? You know, I think if, you know,
Yeah,
it's a tricky one, you know?
it is. You know, anybody who kind of works for him or herself, I think it might be in a similar
Yeah.
position. And you know, if you're have an employer and you're able to take a sick day or whatever, you know, that's a different situation than the situation on a farm or some other occupations
Mhm.
that, you can't, you have to wait until there's some sort of, problem that cannot wait any longer. And then you go to get it evaluated. Or, what we have, unfortunately, a lot of people will do is they'll use either urgent care or emergency departments because they're open at other hours. And that's not really an ideal situation either. For simple things, yeah, I mean, if you have a sore throat and you can't get in to see your doctor and you want to see somebody, but they're not going to do, urgent care is not going to look into, things like your risk factors for heart disease. So, but that does, I mean, unfortunately, emergency departments and urgent care ends up getting a lot of basic things that really shouldn't be there because
Right.
people don't have any other time. They can't go during the day, so they'll go in the evening when one of these other places is open. And
Yeah.
that's not an ideal situation for treatment or for the patient.
Right, because you don't meet your physician, there's no follow-up with it, there's all those kind of things with it. There's no like continuity of care. It's just this ad hoc kind of care. Yeah,
Exactly. Yeah.
I
Eric,
get that.
can
Yeah,
I come
cool.
in here as well? I agree completely. What I see in Ireland as well with farmers is that they tend to prioritize. The farming can be so, especially the beef farming, can be so unpredictable. Things can happen, and even at the mart, they can, we were very flexible. They could say their preferred time of day of the health check, and even then anything could happen. And I remember there was a farmer who had really severe pain on his chest, and it was a really wet winter. There were floods. The cattle was in the cattle had to be sold because they were in.
Yeah.
There was this pressure, and you could the stress among the farmers in the livestock mart was palpable, and he had severe pressure on his chest. And the nurse said, you have to go to the hospital now, you have a heart attack. And before he went, his cattle was in the ring to be sold, and he refused to leave, before he knew that the cattle was sold. The stress of, the pressure, as in, I can't feed, I have to get rid of the farmer. And I never forget that. It was really, as in, from, you could say, like, your health, because your health, without him there is no farm, there is no.
Yeah.
So it is, but I could also understand I could see
Right.
his desperation, as well, as in, I need to have the cattle sold, I can't have the cattle longer in the stables. So yeah, it's a complex um situation, or a complex challenge.
Isn't that just a horrible position to be in? And like, and I obviously know nothing about that context, but I know plenty of scenarios like that, or plenty of people like that have grown up as men under the culture of not to seek help or not to look for, and everything about them has kind of mounted to that point where their identity as a farmer that they probably inherited from their own dad, and who had inherited from his dad. And at that point in the mart, they're there with their cows to make a living on their livelihood. And right at that moment, it meets the intersection of his health and stress that he's been predisposed to, and his help seeking that he has been conditioned not to seek. And I think like it's the epitome of farmer struggles in that little story there. Um, I don't like, if and Vickie and Diana, you might want to come in this too as well. Like, when you meet farmers, Vickie, would they ask, if they get their blood pressure checked and all these kind of things, would they have much questions for you? Are they interested in where they sit, or do they look for like proactive kind of advice maybe around these kind of things?
Some do, some don't. Some are really interested, and I always advise them, if they're blood pressure is high, that they maybe purchase a machine and test it, at home daily, like this, just take 5 minutes, sit down, feet flat on the ground. I tell them how to do it, and just kind of keep an eye on it. And then the next time that they see their primary or see a doctor, they should have those numbers with them so they can kind of know what is going on with their blood pressure.
It's really interesting, yeah. I'm just reading Heather's question here. So Heather works with us here as the clinical case manager. And she's a question: do any of the panelists think that there may be changes in the future to provide care on site and/or flexibility of services and treatment times at clinics? Anyone want to take that? Get that? Might be.
I know like some of our local clinics here have later evening hours, maybe not so much like at the hospital, but like at like the Cherry Valley Health Clinic, which is a local rural clinic by us, on Wednesdays is open till like I think 7 or 9 at night. And they have a lot of rural farmers out in that area. So I don't know if that's something that they've always done to kind of help with the community and have them be seen at different times.
We did something, started, I guess, a year or two ago. We did a few of these on-farm health assessments, and so we actually showed up there on the farm with a team of people, and I think I wasn't at the most recent one where the team actually, I think, may have included a dentist also.
Yes, we did dentist and eye, Dr. Quinn. Yep.
Okay, yeah. When I went, it was just a physician and a nurse and several people doing some of the other testing. So we probably had 4 or 5 of us there. But I remember one thing that was very valuable, I thought, was the nurse was the last person that the worker would see, and would spend a fair amount of time explaining everything, because a lot of stuff needs explaining, actually. And they did have questions, and so that was one thing I found to be, I thought, really valuable, was like having that. The main role that the nurse had there was really to just explain everything, and that was really, I think that was valuable.
Like I'm just thinking as you're talking there, Brian, and what you said, Vickie, that a lot of it is about like, we might take it for granted. All of us here, we work in health in some way, shape, or form, but we might take it for granted that that people understand the importance of like being physically active or something like that, or the part how diet relates to health in these kind of things, and these information sessions, meeting farmers at where they're at, these kind of things. Is that the answer to this? Given the circumstances, that we equip communities or embolden communities to take on the challenge to set up more kind of health promotion spaces and environments in places that farmers already operate in. Like, is that the gold standard with this?
I mean, we did purchase this great new clinical van that we are hoping to use more to go out to farmers and do like a clinical type setting more.
Right. Dan, I'm just thinking about now. I know that like the Fit for Farmers program back in Ireland, where like I'm sure like local sports partnerships, which for the US viewers what would it be? It would be like a locally government funded health and exercise group, and they would have set up specific. It was called like Fit for Farmers, if I remember correctly, Diana, and they would have set up like physical activity sessions just for farmers, completely targeted at farmers. And it was against the backdrop of the kind of understanding of conditioning that, like, if you had set up So for instance, if you set up a yoga class in the community, only women of a certain type would attend the class. You probably wouldn't even get men in a lot of rural communities that would attend it. Maybe more kind of, you know, middle or more upperly mobile men might attend it. But if you change that to a kind of like a circuit class, you invite more men into it. But if you change that then to a men's only circuit class or something, then you get a lot more men into it. And then if you change that to like a farm, if you target it specifically at farmers, then you get all the farmers who come out to these events, if I'm right in saying, Diana.
Yes,
So it's this
yeah.
whole kind of marketing side of it, that they knew they were going to meet other farmers. They knew they weren't going to be like physically kind of feel physically maybe vulnerable there, or like vulnerable in the setting. So they'd you know,
Yeah.
that their peers would be there and that, you know.
Yeah, no, those projects in Ireland are hugely successful, and that also addresses another really important point, and that's isolation, which, you know, isolation in itself can also cause a lot of health problems. You know, with farmers, when we did the lifestyle program, it doesn't make sense to say now you have to go to the gym, and because they won't. That's not,
Yes.
you know, so it has to be part of what fits in their life. So we use the farm as a health promotion setting, but indeed as well, a lot of farmers went dancing, for example, in Ireland, which is a huge thing. But we also have these specific farmer activity groups, which are very popular, and they are 5 or 6 weeks, you know, an hour where they do exercises, and which is also a really good social outlet. About the yoga, there's a Kerry group, a male farming yoga group in Kerry.
Yeah, right.
Yes, hugely, and there's
Yeah.
really so it and I feel these programs just have this double you know, double whammy impact, as in you do something on your fitness which is nice, and you meet peers, and you have a chat as well. So these are very important projects. Unfortunately, in Ireland, they are mainly local. So the sports partnership have the men fitness groups, but they are not only targeted at farmers. So we have the Fit Farmer group, we have the Kerry Yoga group. So there's different groups there over Ireland, but they tend to be local. And I agree very much with your previous point that we take it for granted that we know, you know, the basics. And for a lot of people, not only farmers, it is not as simple as in, oh yeah, so, you know, all the health promotion activities and outreach is very important to help people to understand what they can do to prevent certain issues. And like Brian said as well, the explanation is important, because you can go to the doctor and have your cholesterol and 10 minutes later you're outside, or you can have what we did in Farmers Have Heart, where the nurse explains this is good cholesterol, bad cholesterol, this is, and you have a clustering of this, and the risk factors of that are you eating breakfast? Well, maybe you should start eating breakfast. How many sugar do you take in your tea? 5. Well, maybe start with 4, then 3. Like, you know, all these simple ways of understanding how these lifestyle impacts work and how they can you know, gradually improve it is very important. I feel no offense, Brian. The doctors are very important, but the nurses are gold. They are so, they have the contact and the interaction and
you know, and even though I'm not a nurse, you know, I'm a tech, and I do a lot of explaining to the farmers with their numbers about, you know, what their numbers are, if it's good, if it's bad, if they, you know, what they should do to change their eating habits to help them, you know, more diet, more exercise. And we kind of go over all that with them. And then they do understand that, you know, hopefully when they leave me, that they go out with a better understanding. So,
yeah,
and we
very
do give
important.
them, pamphlets and information also.
Really interesting stuff. I'm just see the chat is busy here again. Brenna Quinn, who's a research assistant here at NYCAMH, has a comment and a question. Bringing the clinics to the farms themselves is an interesting and proactive idea. I imagine this helps farmers and access to healthcare. Do you also see benefits for farm workers and migrant labor with these clinics, or is it mostly localized? Vickie, I don't know, do you want to, do you get
We
farm?
have seen migrant workers. Actually, the last health assessment that we went to was mostly migrant workers, which is kind of nice. And that's when we did the dental and the eye. We brought out a dental hygienist and a dentist, I believe, with us, and someone that did vision. And they, like, if they needed, they had readers and stuff, so they would give them, if they needed for readers, they would give them glasses. And we did the glucose and cholesterol A1Cs with them, and they saw a provider. So
Great. I don't know, Diana, do you want to come in at that point? I don't like, it might be more of a thing. I don't think it's as much a thing in
No.
Ireland.
No, in Ireland we have fewer migrant workers. We do have farm workers, and what we're trying to do is specifically target, the recruitment. So we focus on trying to get as broad as possible locations for the health checks, and also having a multi-actor approach of working with different organizations to try to utilize their sites as well for health checks. And in that sense, try to reach a broad social demographic profile of farmers and farm workers. Yeah.
Really great. Folks, we're just coming up on time. If any of our attendees have any comments or questions or queries that you'd like to pop into the chat before we finish up, please do so. I'm just thinking about, the conversation and where we've came from it today. We talked about a lot of the, just the structural nature of healthcare for farmers, structural nature for anyone with it, and why it's more acute for the farming population. We spoke a lot about even the cultural barriers too with the farming population, not least as Diana, that you touched on around gender and these aspects, and then there were recent points around education and that. Do you have, what would be your closing comments at whatever level you want to take it from? If that's from like a research capacity, Diana, maybe, or where does research need to evolve in this area? If you've advice for farmers that may see this video, or even for service providers. I think that's a really important point for service providers when they do come in contact, or a farmer does, come to a physician or whoever it is, that's not taken for granted by the physician. The kind of hurdles that they have overcame, personally, with the cultural barriers that they've overcame, the structural barriers like working on the farm to get into a health clinic, and that as a physician or a nurse or whoever meets them doesn't take that for granted and uses that opportunity to try and create a more proactive farmer around their health. So just any closing reflections that people might have. I don't know, Brian, do you want to kick us off?
Well, this is not necessarily what you were just mentioning, but I did want to say that we look at things like blood pressure and cholesterol and that and kind of as risk factors to keep in check and stuff. And that over the years, that has become what used to be considered high blood pressure. Now the number is much lower. So these organizations, cardiology organizations and heart organizations and such, have determined that really a healthy, blood pressure is like 120/80. That's what they want to see. They don't want to see it above that. And same with cholesterol. They used to be a higher number. Now it's like come down a little bit. And so just in terms of, again, this is for everybody. These the guidelines have become sort of stricter over time because it's felt that it really makes a difference. And that's something to emphasize to people when we have our one chance to see somebody in a year. And we do it all the time when we're seeing firefighters and they have their blood, many times their blood pressure's high. And, and that's something that, we have, it's sort of, that's our opportunity to say, look, you got to do something about this. And of course, it needs to be confirmed. You don't just base it on one reading. But aside from that, so I think that's just like we need to use our time that we have these interactions with people and make the best of them.
Thanks for bringing that in, and thanks for even applying it to the general population, because as we said, there's it's not just farmers that need to be reminded about these things, and for us to not to take these things for granted. Vickie or Diana, do you want to jump in with some closing reflections?
Well, I would also like to focus on this issue from a broader point of view rather than only a behavior point of view. There's also systemic influences, and in Ireland, farmer health falls in between everything. So it's not really part of public health. It's not really occupational health. It's not in agricultural policy. It's touched on, but not how it should be addressed. And I feel to just facilitate farmer health better and farm safety, because a healthier farmer is also a safer farmer, and that lead to higher production, because that's what is in these policies. It tends to focus on production. So I would like to see a more holistic approach to farmer health and an interdepartmental policies and approach to improve and support farmer health as well.
That's a really important point. Yeah.
I agree. I think that even if I help one farmer, it's important. So, to let them know, their health is important to us and to them. So I think that's something that I like to focus on when I see them individually, at health fairs or clinics. So
yeah, and you might have like 2 or 3 minutes to get the point across, or to give them some feedback or whatever, and that 2 or 3 minutes could be,
it could be life-changing for them.
Yeah. It could be, literally could be, because it could be in the first time that someone has sit down and spoke to them. Not the first time, but it could be in the first time in a long time that's happened, and I think we all have a duty or responsibility to be aware of that.
Well, I feel like if they're taking time out of their day, then it's important to them too.
Totally. Well, folks, on that note, I think we'll leave it there. A special thank you to all the people who jumped on to today's session, and to the folks who popped into the chat, and put in comments and questions and that. It's been great, and to our panelists, to Diana, to Vickie, to Brian, it's been brilliant. So just on the fields of knowledge more broadly, so we run these at the last Thursday of every month. We have 2 more sessions before we finish up for the summer. The next one looks at debts of despair, another exciting topic. So like debts of despair is an umbrella term for like self-imposed harm in rural America. There was a big study that came out in New York recently that looked at county level predictors of mental health. So we're going to have the author of that on for the next session. And we'll break down that topic a bit more. Debts of despair is like suicide, drug overdose, alcohol-related cirrhosis of the liver. So it's kind of, it's going to be an interesting topic. So that's it. You might have noticed in the chat that Destiny popped in a survey. If you just scroll up a couple of messages, you'll see the post, the evaluation survey that Destiny popped in. If you could fill that out just before you hop off, that'd be very, very much appreciated. Okay, folks, thank you very much, and we'll see you all next month.
Thank you.
Thank you.
Thank you.
Bye-bye.
Bye.
Bye-bye.
Bye.